Bonjour, hello everyone. Thank you for tuning in to the Cashew Podcast. As we all continue to navigate the many ups and downs of life during a pandemic, I hope you continue to stay well and find gratitude in even the smallest of things each day. In today's episode, I was fortunate to visit and chat with Minnesota's Lieutenant Governor Peggy Flanagan. There are many things that I love and appreciate about Lieutenant Governor Flanagan, but a couple things that stand out to me include her ability to stay grounded in her values and the genuine hope and positivity she carries in even the most challenging times. During our conversation, Lieutenant Governor Flanagan discusses how she has been navigating change and loss due to COVID-19, including how she is taking care of herself and her family. Lieutenant Governor Flanagan highlights some of the ways that she and Governor Walz continue to advocate for vulnerable children and families during this time, including important policy changes that are underway. I really enjoyed my time with Lieutenant Governor Flanagan today, and I hope you enjoy the conversation as well. You may also notice the emergency sirens going off in the background and possibly even my cat shuffling across my table multiple times. And well, that's the reality of working from home. Relatable content, right? Happy listening. Today I'm talking with Lieutenant Governor Peggy Flanagan of Minnesota. Peggy, how are you doing?
I'm doing okay. I think that's always a really interesting question right now as we find ourselves in a pandemic. It's been a kind of difficult year for our family, 2020, but I think for a lot of families, it's been a difficult year. We lost my dad in January, and then in March, my brother was diagnosed with cancer, and then shortly thereafter contracted COVID and passed away due to complications from COVID-19. And so this has been really personal for me, and I know that it's been really personal for a lot of Minnesotans as well. But I am also grateful for my health, for time with my husband and with my kiddo, and just that we've been able to try to figure out how to navigate this as a family as well. So the work looks different right now for all of us as we are on phone calls and video conferencing. And one big adjustment just for me has been, Governor Walz and I are truly partners. And so we literally sit next to each other at the head of our long conference table at most days before the pandemic. That's what we did. And so it's weird to not be working with my buddy side by side each day. But we are in constant communication with each other, and are navigating also distance learning with my 7-year-old, like so many people. And there are good days and there are bad days, but everyone's sort of just doing their best right now. And I think that's really all that we can do in this moment. That's just huge and stressful and overwhelming, and just try to navigate through it and do our best.
Absolutely. Well, and I know myself and many others in community are, we're sending so much love to you and your family, and knowing that it's been a really tough year, and just really feeling all of those feelings around everyone being impacted in so many ways during this pandemic. I'm wondering if you could share a little bit about what are some of the coping techniques you're using and how you're taking care of yourself and as well as your family while you're at home and continuing to work lots and, like you said, distance learning.
For sure. So, we try to get outside as much as we can every day. And so we have a loop that we do that's like 4 miles, which before the pandemic, I would never have been like, let's go for a 4-mile walk, everybody. Right. So that, that is new. And my daughter is constantly on her scooter and scooting around, or on her bike, or we're flying kites, and just trying to do as much as we can to just be outside. And one of the good things I think that's happening is that this pandemic is happening during a time when the days are getting longer, it's getting warmer, and we can spend that time out of the house in a way that is safe. We wear masks when we're around a lot of people in parks and that type of thing, but are trying to do that. And I just also have to say that as a Ojibwe woman, there are things that we have at our disposal to be able to care for ourselves. And my friend Sarah Broken Leg sent me a care package that had traditional tobacco from all over the region, and some cedar. And we try to smudge every day. And even though we have to stay apart, which is, I think, so counterintuitive to just like who we are culturally and as a community. But those are our traditional medicines are one of the ways that we can stay connected to each other during this time. And they are the things that have gotten us through previous pandemics and challenges as well. And so that's been good. And just trying to find some time to get on Zoom and see family and friends in ways that I'm appreciative that we have sort of, Jetsons technology now where we can see each other and have these conversations. And also, like, just to be honest, like, I'm also eating my feelings like many other Minnesotans during this time, and watching really terrible television on Netflix and Hulu. And I won't share with you what those shows are, because you might lose a little respect for me. But I can guarantee if it's trashy, I'm probably watching it.
So are the rest of us. And I feel like have you made a loaf of banana bread in pandemic life?
I have not yet made a loaf of banana bread, but I can tell you, my good friend, Representative Jamie Becker-Finn, dropped off like several pounds of wild rice from Leech Lake. And so we are having wild rice for dinner, wild rice for lunch, berries and wild rice for breakfast. So like, I feel like, that is the thing that I can kind of, get zen about and cook. And so we have a lot of that happening in our family meals right now.
Yeah, that's great. I mean, and along with the traditional medicines and taking care of ourselves, and like even wild rice being nourishing and good, healthy food for us. So I'm glad you all are getting a little bit of everything, the good, some trash TV, we all got to do what we got to do.
That's right.
And so, as you mentioned, you're a mama and you're home with your kiddo and your husband and your family. And so as a mom, you understand how challenging it can be for parents and caregivers who are at home with their little ones right now, and everyone's struggling and out of routine and searching for normalcy. Is there anything you can share about efforts that are taking place, within leadership and policy funding around the state to support our families that are at home right now? I know that's a big question, and there could be education or other essential services. Just anything you can share related to supports for families underway or on the horizon.
Yeah, absolutely. So I appreciate that question. And I think I do have quite a bit of information to share. But I think, I'll just start by acknowledging how incredibly hard this is for folks. And we had big dreams at the beginning of the pandemic to have a set schedule every day, and to, say like, from 8 to 9, we're going to get out and walk, and then we're going to do this, and then it's math time and reading. And like, I will be the first to say within like day 2, that was like all out the window. And so just to be clear, this is something that we have never done before. And so, it is really difficult. And so if you're someone who's working from home, or if you are in a essential position, are essential workers, that are not working at all, parents are under immense stress as providers and as teachers, entertainers, supervisors, and that's happening like all at once. So we are lifting up with our partners in the legislature, and specifically in the nonprofit sector, and philanthropy, ways that we can lift up families, especially right now, as we are also looking very intentionally at our families who are most vulnerable during this time. Starting with distance learning, I know this has been an incredible challenge for folks, and it is simply amplified by families who don't have access to Wi-Fi, reliable internet, or devices. Our family also, we are grateful that our child goes to a district where they had enough resources to be able to provide a Chromebook for students, which we don't have an extra computer laying around the house, and we have one child, and so that's been helpful. But I know that not everybody is in that position. So our Department of Education is really focusing on student relationships and connections between teachers and students and support staff, technology, and then just generally student safety and well-being. So this traumatic experience has been amplified for our students who are already experiencing trauma, and it's why our focus has really been on ensuring that those relationships with the students, that those are maintained and strengthened, if at all possible, giving additional support to educators and to districts through family engagement toolkits, resources on building relationships, how to teach virtually, which is certainly a challenge, and also just ideas for communicating and supporting families most impacted by the inequities of COVID, knowing that things like attendance is a scary issue for many of our families who are wary of the child protection system. And we know that our children, that Native children and African American children, are removed from homes at higher rates. And so working on strategies there to make sure that truancy does not become an issue where people have to live in fear simply because they cannot connect. So that's particularly important to me. And we're also looking for additional resources to support students through technology, starting to think about what summer school looks like to do safely, and then the ways that would be able to then inform the fall and what that looks like for families as well. Related to childcare, we have done quite a bit of work there and have created supply chains to support childcare providers in cleaning products and hand sanitizers, masks, and launched specific tools to support public health needs for those childcare providers. We have proposed and successfully championed $30 million in childcare emergency grants, with $9.8 million going out to 1,200 providers in the last month. Philanthropy has also secured an additional $1.5 million in private supports for childcare as well. Launched mn.gov/childcare to support providers and families, and created weekly updates for childcare providers who are caring for many of the children of essential workers, and are also wanting to protect themselves and their own families. And then have also helped navigate additional financial supports for those providers as well. We are in a childcare crisis before this pandemic, and so we are desperately trying to do as much as we can to not lose ground. We also know that families themselves are really struggling, so economic stability is a really critical issue. We've proposed at the legislature $500 emergency grant to all families who are currently accessing MFIP. our state, of course, our cash assistance program for the working poor and for low income families, but also like these dollars already exist, right? And all we're asking for right now is for the legislature to allow those dollars to be distributed directly to the families who they are made to support. So, could use additional support from your listeners to try to get that out over the finish line. We've stood up substantial changes to our unemployment insurance program and federal changes to unemployment benefits while addressing a really unprecedented number of applications, and then have adapted our public work support programs like SNAP and WIC and healthcare to increase access for families to these supports. And this is more, of course, more critical now than ever before. And we're grateful that much of that work has happened quickly to get to families. And then just to ensure that our families have information about additional financial resources, federal and state, that are available to them. And as we continue to receive additional dollars from the federal government, making sure that those are going to families who are in crisis and who are, frankly, too often we're invisible to decision makers before the pandemic, and clearly are now. And so we need to be unrelenting and just making sure that the narrative is there about the families who are truly in crisis, and their crisis has only been exacerbated by the pandemic.
Yeah. And when thinking about reopening and kind of that phase opening, we hear Governor Walz and yourself and kind of having to contemplate and think very critically about, we know it's complex, it's not black and white. There's some Minnesotans who are very frustrated and want to quickly open and be able to get back to some of that normalcy, and others who are worried and fearful. And is there anything you'd like to say to Minnesotans, families who are on both sides of those kind of feelings and realities about reopening and kind of what that looks like for us?
For sure. I think every family in Minnesota is hurting. We're just not all hurting in the same way. And so, like I said before, this crisis falls hardest on families who are already in crisis. And for families of color, for Native families, this can also be a reminder of the gaps in support for our communities, and how, again, we are often invisible. For families who have loved ones who are who have either been diagnosed with COVID, have been infected by it, or for folks who have lost family members, or for people who have loved ones or they themselves have underlying conditions, which we know for our communities, for communities of color, that this is something that weighs heavy on people consistently. So the idea of reopening too soon, I think, is terrifying for many of our communities. Families who rely on the income of small businesses, maybe one that's been in their family for generations. The idea of opening too late for those folks is also terrifying. So, we know that people, that there are emotions and there are risks on each side of this, and that's why we're trying to be really intentional and use data and rely on our epidemiologists and healthcare community to be able to do this in a way that puts the fewest number of people at risk. And again, the pandemic has really hit every aspect of our lives. And I want to just say to Minnesotans who are living in fear, that I see you and I hear you and I value you. And you are the people who we think about as we make these decisions every single day. There's not an easy solution or a perfect solution. And all of these challenges, hurt. So I also think that Minnesotans are responding in a way where most of us have come together. And most of us are helpers. And I think about often, that Mr. Rogers line where he said, for children who are afraid or during a crisis, he said, my mother often told me to look for the helpers. And the good news is that there are helpers all over the place in Minnesota. We asked people to make homemade masks, and we received 137,430 masks that were delivered to fire departments. And literally every single fire department in the state of Minnesota received those masks. So those are the things I think that also are the bright spots in this challenge and pandemic, and that are the things that we need to remember as we are navigating the situation together. It's all new. It will continue for quite some time, and we're going to have to figure out how to cope and adapt. And there are detractors who may put themselves and others at risk during this time, and who may react from a place of fear and violence. And that's scary. But I think the overwhelming majority of Minnesotans want to do right by each other. And I think that's what we can see right now.
I love that the tests are going off right now. I mean, this is how we adapt in pandemic.
That's right.
Okay, looking at time, I just have one more question for you. So, in a place of many unknowns, what does the next year look like for Minnesota?
That's a really great question. And I wish that I had a crystal ball to be able to tell folks what the future holds. But I think, what we know is that this virus has laid bare and exacerbated the existing inequities in our system. And I hear folks say often, I can't wait to get back to normal. And what I want to say is that normal was not working for us. Normal was a place where we had deep inequities in our community, as far as wages, access to healthcare, education, and that too often those disparities and inequities are plaguing Black and brown bodies. And so normal is not what I am interested in returning to. And I don't think the governor is interested in returning to normal either. I want to, instead of getting back to normal, I think we need to get back to better. And we are working with our community resiliency and recovery work group, which is grounded in ensuring that as we look towards recovery, that people of color, Indigenous folks, immigrants, and refugees are at the center of how we recover, and that the solutions will not come from state government systems that are historically full of inequities, and a system that has for a long time excluded our people. And so we are going to need to rely on the community for those solutions, and then determine how to best integrate those into our recovery in the long term. So it shouldn't be about getting back to normal. It's getting back to better. And I think for many of us, this is the moment that we were made for. And need to remember to take care of our spirits and to take care of ourselves as we navigate through this time. But that we can do this collectively, and we can do this together.
Chimiigwech, many thank yous, Lieutenant Governor Flanagan, for joining me today and taking time out of your very busy schedule, and just for everything that you do and all of your advocacy for all of us across Minnesota. I really appreciate you.
Well, thank you so much for this opportunity, Chimiigwech. I am so grateful for the work that you do every day, and that as our social workers and those who care for others, it's the work, and it is incredibly important. So just so much gratitude and love in my heart for you and for everyone who does this work on the front lines to make us even better, to all of the helpers. So thank you.
This podcast was brought to you by the Center for Advanced Studies in Child Welfare. This podcast was produced by Korina Berry. Our series editors were Denise Cooper and Cliff Dahlberg. Music was composed by Big Cats, and this podcast was supported in part by a grant from the Minnesota Department of Human Services Children and Family Services Division. For more information, please visit the CASHU website at cascw.umn.edu. Thank you for listening and stay well, everyone.